Hi everyone, Dr. Linder here. In this presentation, we will cover a brief review of some of the common histology slides that you should be comfortable with. So to review, let's look at epithelium and remember some basic questions we ask ourselves. Do we see cells closely packed together or are they far apart? If they're close together, it's epithelium. Then the next question is, hey, is it one cell layer or multiple? That would be the difference between simple and stratified. And then what's the shape of the cell? Is it flat, irregular? Is it cube shaped or is it columnar? Or does it look like it's stratified and it's not? And does it look like it's multiple shapes? That would be transitional. Okay, so what we're looking at here, let me turn my pen on here. We'll make it blue. So notice we see lumen. All right, so here is the lumen. And what we're looking at here, we're trying to look at the shape of the cells that are close to the lumen. We see them on both sides. So this happens to be the nuclei of it's one cell layer thick. So it's simple, and they're squamous cells, okay? This is a red blood cell, right? So we're looking at liquid connective tissue traveling through here. But what we want to know is what is the type of epithelium, and we would have a line, if I was asking it, pointing to this structure here, or this structure here. When we look here, and you can see on the upper right, simple squamous epithelium at 160 times the resolution. So these are flat, irregular cells. They're closely packed together, and they have a central nuclei. So simple squamous epithelium. To contrast, if we saw another round cell, but the nucleus was in the periphery, that would be an adipose cell. Okay, let's look at this one. Again, here is a lumen. And here's a lumen. This is the space. And here's a lumen. So what we're doing, and this is of the kidney, we're looking at these cells that come into contact with the lumen. And we see that it is only one cell layer thick, and they're squares. They're cube shaped. So it's simple cuboidal, or simple cuboidal epithelium. Here, we're looking at the kidney again. Here is the lumen, right? This is like the pen cap that I showed earlier. If we're looking inside the lumen, and now we have cells that are here. They're not flat, they're not columnar, these are cube shaped. So again, simple cuboidal epithelium. This is another lumen, and this is another lumen, and throughout there are a bunch of simple cuboidal cells. Now, this should look different than this, the shape of the cells. So we see cells closely packed together, so we know it's epithelium. We see that the nuclei, for the most part, are pretty much aligned, right up the center. And they are columns. And it's one cell layer thick. So simple columnar epithelium. This cell here and this one here, these are important. These are goblet cells. They produce the mucus. And you can see the microvilli, or the brush border, which is this from here to here. That's the brush border. So this is going to release or secrete mucus. The mucus is going to stick here. And this is of the small intestine. So all the nutrients are going to stick and they're going to be pulled in. to those intestinal cells for absorption. Okay, here's another one. It's a larger magnification. We see cells closely packed together. They are epithelium. And these columnar cells are one cell layer thick, so they're not stratified. So it's simple, and they're columnar. Once again, this is a goblet cell, and we can actually see exocytosis happening. It is secreting. It's a goblet cell that's pushing out the secretion that will stick to the cell's surface. Okay, so it's simple columnar epithelium, but if an arrow pointed to this structure, it's a goblet cell. All right, let's look here. We see a bunch of cells closely packed together. Look at the nuclei. They're all at the same level. So it's one cell layer thick, so it's simple. And once again, these are columnar cells. Okay, this is all the apical surface, or it's some lumen. So the cells that come in contact with it are columnar cells, simple columnar epithelium. Let's look at this one. Now, this one looks a little bit different than this. Let's look at the nuclei and see how linear these are. So it's simple. When we look here, the nuclei are at different levels. Here are some nuclei at this level. Here are some at this level. Here are some at this level. So it's giving the false appearance that it's stratified, but it's really not. So they're pseudostratified columnar, and we still have goblet cells. These are going to produce mucus, and it's going to stick to the cilia that we have up here. And those cilia are going to beat rhythmically. This is the trachea, so this is the windpipe. So sometimes even seeing and knowing where it's coming from can give you some hints when you think of function. Okay, when we look here, here's another trachea. So it's the respiratory tract. Again, it is pseudo-stratified. When you're studying, I think it's a great idea to know what you're looking for, then you can see it, right? Know what you're looking for. So you have to train your eyes. So it's pseudo-stratified, and you're going to say, well, yeah, it's pseudo-stratified because there's some nuclei at this level, and there's some nuclei at this level, and some here at the bottom, but they are columnar shaped, so it's pseudostratified columnar epithelium. And again, you could see the goblet cells here, another goblet cell, here's another goblet, another goblet. Those are mucus producing. Here's the trachea again, close-up view. These are pseudostratified columnar epithelium. There's cilia there. There are goblet cells there. Okay. So it's pseudo-stratified columnar. All right, now we're looking at a different type. So let's take a look and see if we can see it. Stratified, multiple layers of squamous cells. So all of this from here to here, even probably a little bit lower, probably till around here, all of these are multiple layers of flatly shaped all the way till about here, stratified squamous. It's in the esophagus. The esophagus and the epidermis, areas of parts of the body that are exposed to the outside world, right? You could swallow a cracker that's sharp, has a corner to it, and it can scratch your esophagus. So we need lots of layers of protection here. The skin needs lots of layers of protection. So we're going to see stratified squamous, not only in the esophagus, but also in the top layer of the skin in the epidermis. Okay, here's the vaginal area. Once again, stratified squamous. From here to here, we're going to have multiple layers of stratified flat irregular shaped cells. Here's the lumen, right? This is the lumen. All of this. So the cells, they're not columnar, they're not cubed, they're squamous, they're multiple layers, stratified squamous epithelium. Close-up view, vaginal area once again, from here to about here. Again, they're flat, irregular cells, multi-layered, so it's stratified squamous epithelium. Now we're looking at the skin. Let's look at everything from here to here. Many layers, stratified squamous epithelium. It's not one layer, it's multiple. And you can even see that there's some shedding that's taking place here and here because the top layer, which is called a stratum corneum, does slough off. The dermis is down here. The epidermis is everything from here to about here. That's the epidermis. And it takes about 4-week journey for cells to go from here and to work their way up and eventually slough off. It takes about 4 weeks normally for that to happen. Okay, here once again, this is thin skin compared to thick skin, but here, this again, once again, this is stratified layers, many layers of squamous cells. Here's the esophagus. Everything from here to here. Many layers, stratified. Because remember, up here is the lumen. That's the lumen. So what do the cells look like? They're flat, so it's stratified squamous epithelium. Okay, here is a lumen, and here is the lumen. Now we're looking at a sweat gland that's found in the skin. Now these are cube-shaped, and they're not one cell layer, these are multiple. So now they're cuboidal, but in this case, they're stratified cuboidal epithelium. Right, you can see here's one layer, here's another layer, here's another. So anywhere from 2 to 3 layers, right now it's stratified. Now this is the urinary bladder. And remember what I said about the urinary bladder is that it can alter in shape. It can be distended, it can be filled up with urine, or it can be its normal relaxed state. So when we see some cells that may look like this, and then some cells look like this, and some are like this, when we see different shapes, that's transitional epithelium. And again, you're only going to see that in the urinary bladder, in the urethra, and in the ureters. Those parts can be stretched or alter in shape. Here again, there's the hint, the urinary bladder, and we'll see some cube-shaped cells, we see some flatter cells, we see some cubes, we see some flat, we see more cubes. So when we see multiple shapes, it's transitional. Okay, and here's the lumen of the urinary bladder, so that's a hint. Here's another one, urinary bladder. We see some that are flatter, we see some that are flatter, and then we see some that are cubed. Again, the hint is knowing where the tissue is coming from, and typically we'll throw you that hint there, urinary bladder. Or we'll see ureter or urethra, that's transitional. Now this one's a really cool slide because it shows a few things. So here's the lumen, right? Here's the lumen, and we're looking at an artery. So we know blood is going to be flowing through there. Now, this part here, closest to the lumen, this part is simple squamous epithelium. It's one cell layer thick, so it's simple squamous epithelium. But I really like this slide because it also shows another type of tissue, right? This is showing epithelium, but an artery also shows smooth muscle. So this, look at the smooth muscle, see the spindles from here to here? This is smooth muscle, and smooth muscle is involuntary. It can constrict or dilate. And it's this smooth muscle around an artery that makes it vasoconstrict or vasodilate. If it's dilating, it's opening up, blood pressure goes down. If it vasoconstricts and the lumen gets smaller, then we're going to have blood pressure that goes up. So I really like the slide. I want you to understand that we can see two types of tissue here: epithelium surrounding the lumen, and then this other layer, which is smooth muscle, which is involuntary. Now, this is areolar connective tissue. Now we're looking at connective tissue. Big difference between epithelium that has closely packed cells. Here, we're looking at cells that are scattered all over the place. You've got some collagen fibers, you've got some fibroblast cells, we got elastic, but the cells are scattered far apart. This is areolar connective tissue, which is loose connective tissue. Here's another areolar connective tissue. Okay, the areolar is important. This is where most injections are given, which is that gap or that space between the skin and the muscle. That's where a lot of the blood vessels lie. So that's areolar connective tissue. Again, we see some elastic fibers, we see some cells. So when you have cells that are far and scattered apart, and then you have some proteins like this, and they're not closely packed together, that's what connective tissue is. This is reticular connective tissue. This is what makes up most of the substance to your organs and gives it its shape, like the spleen and the kidneys. This is called reticular connective tissue. Again, here's reticular connective tissue. It looks very different than areolar. Here's areolar. Here's connective. Here's reticular connective tissue. Okay, here's fat. Here's adipose tissue. Now, what we're looking at here, some say, well, it's simple squamous epithelium, but when we look a little bit closer, we're going to see that the nuclei are off center. You do not see a nucleus in the center of each of these, right? If you saw a nucleus in the middle, yeah, I'd say, good argument for simple squamous epithelium, but these are adipocytes. These are fat cells. This is a fat cell, an adipocyte. Okay, now this is cartilage. This is hyaline cartilage, which is what we find at the end of the bones. These have a unique type of appearance, right? When you look at this is a cartilage cell called a chondrocyte. They look like raindrops, right? Pretty translucent, clear raindrops. Hyaline cartilage has this look. No other cartilage has this type of appearance that look like crystals or raindrops. That's hyaline cartilage. Again, we see cells that are far apart from each other with lots of matrix in between. They're not closely packed together. That's hyaline cartilage. Elastic cartilage is a little bit different. Elastic cartilage is what we see here, made up of elastic fibers. Okay. I will typically, when you see cartilage, I typically ask for hyaline cartilage on my test compared to elastic cartilage. I'll typically show hyaline cartilage compared to elastic cartilage. But cartilage in general, they both have that appearance, right? The crystals, those little raindrop looking structures. That's elastic cartilage. Just has more flexibility and elasticity than hyaline. All right, now this looks like the tree that was cut down, right? Each of these are osteons, right? This is compact bone. This is an osteon. In the center, we see the central canal or the haversian canal. That's these holes in the center of each osteon. Now here we could see a few things. We could see the lamellae. These are concentric lamellae. We could see the hollowed out cavities, the lacunae. That's a lacunae. And what sits inside of a lacunae is an osteocyte. We could see the central or the haversian canal. Again, the central or haversian canal. Again, this is compact bone or the osteon. Now here is the lacunae. Here's a lacunae. Here's a lacunae, but what you can see coming off of it here, really nice, are the canaliculis. Those are those canals. Those finger-like extensions coming off of it are called canaliculis. Really good view of seeing it here. Those are the canaliculis. Now here's a blood smear. If I point to this one in particular, it's a red blood cell or an erythrocyte. If we point to this cell here, this one is a neutrophil because it has, let's see, 1, 2, 3, maybe 3, 4, right? 3 to 5 nuclei, heads to the nucleus. And we see it's granular. The cytoplasm is granular. That's a neutrophil. Okay. And the plasma is the stuff in between all of the cells. All of this is plasma.